Welcome to Nursing-Related Philippine Jurisprudence, written and narrated by John Igor T. Galinato. This next case is captioned Ramos et al. Versus Court of Appeals, De Los Santos Medical Center, Dr. Hosaka, Dr. Gutierrez, GR number 124354, promulgated April 11, 2002. The facts of the case. Erlinda Ramos was admitted at De Los Santos Medical Center for cholecystectomy. Dr. Hosaka, the surgeon, came in late. Dr. Gutierrez, the anesthesiologist, had not conducted the required pre-anesthetic or preoperative evaluation the day before, so this is his first time to see the patient. Also in the operating room is Herminda Cruz, a nurse, who is a sister-in-law of the patient. During the course of the surgery, the woman suffered respiratory distress, her skin turning cyanotic, and she died. The Regional Trial Court and the Court of Appeals found the doctors civilly liable. The issue in this case is whether or not the doctors Hosaka and Dr. Gutierrez are guilty of medical malpractice. The Supreme Court ruled yes. The unreasonable delay in petitioner Erlinda's scheduled operation because of Dr. Hosaka, the surgeon, arrived late, subjected the patient to continued starvation and consequently to the risk of acidosis, or the condition of decreased alkalinity of the blood and tissues, marked by sickly sweet breath, headache, nausea and vomiting, and visual disturbances. Her anxiety adversely affected the administration of anesthesia on her. The patient's anxiety usually causes the outpouring of adrenaline, which in turn results in high blood pressure or disturbances in the heart rhythm. Dr. Hosaka's irresponsible conduct in arriving very late for the scheduled operation of petitioner Erlinda is violative not only of his duty as a physician to serve the interests of his patients with the greatest solicitude, giving them always his best talent and skill, but also of Article 19 of the Civil Code, which requires a person in the performance of his duties to act with justice and give everyone his due. Dr. Hosaka, the surgeon, is also liable under the captain of the ship doctrine. The anesthesiologist Dr. Gutierrez is also liable because his failure to conduct the needed pre-anesthetic preoperative evaluation contributed to the patient's respiratory distress. The Supreme Court stated that the conduct of a pre-anesthetic or preoperative evaluation prior to an operation, whether elective or emergency, cannot be dispensed with. Such evaluation is necessary for the formulation of a plan of anesthesia care suited to the needs of the patient concerned. Pre-evaluation for anesthesia involves taking the patient's medical history, reviewing his current drug therapy, conducting physical examination, interpreting laboratory data, and determining the appropriate prescription of preoperative medications as necessary to conduct of anesthesia. Physical examination of the patient entails not only evaluating the patient's central nervous system, cardiovascular system, and lungs, but also the upper airways. Examination of the upper airway would in turn include an analysis of the patient's cervical spine mobility, temporomandibular mobility, prominent central incisor, deceased or artificial teeth, ability to visualize the uvula, and thyromental distance. In this case, the patient had a short neck, which caused the intubation of the tube to be properly inserted. There was also no evidence on record that Erlinda developed an allergic reaction to the anesthetic pentothal. The court also gave weight to the testimony of the nurse sister-in-law, Cruz, stating that although she is not an anesthesiologist, she can very well testify upon matters on which she is capable of observing, such as the statements and acts of the physician and surgeon, external appearances, and manifest conditions which are observable by anyone. This is precisely allowed under the doctrine of res ipsa loquitur, or the thing speaks for itself, where the testimony of the expert witness is not required. It is accepted rule that expert testimony is not necessary for proof of negligence in non-technical matters, or those of which an ordinary person may be expected to have knowledge, or where the lack of skill or want of care is so obvious as to render expert testimony unnecessary. The High Court also took judicial notice of the fact that anesthesia procedures have become so common that even an ordinary person can tell if it was administered properly. As such, It would not be too difficult to tell if the tube was properly inserted. This kind of observation does not require a medical degree to be acceptable. The Hospital de Los Santos Medical Center was absolved from liability because the doctors in this case were consultants. They weren't paid by the LSMC. Further, no evidence was adduced to show that the injury suffered by petitioner Erlinda was due to a failure on the part of the LSMC to provide for hospital facilities and staff necessary for her treatment. Thus, Dr. Hosaka and Dr. Gutierrez were held solidarly liable for the following civil liability: moral damages of 2 million pesos, exemplary damages of 100,000 pesos, attorney's fees of 100,000 pesos, or a total of 2,200,000 pesos.